So we just got done talking about some interventions and the pathophys of rheumatoid arthritis. Now let's continue with our interventions, and part of that would be medications for RA. Number one, Methyltrexate. Now this is an anti-inflammatory. You have to know a couple of things about methotrexate. One, that it causes bone marrow suppression. Two, it causes hepatotoxicity. So therefore, that lets you know a couple of things. One, if it causes bone marrow suppression, part of the systems that may be affected would be something like your CBCs, your WBCs, your complete blood count. Your white blood cell count will be affected. Therefore, you must get a CBC routinely. You must monitor the CBC routinely. The other thing that you have to monitor, just because we talked about hepatotoxicity, well, you must also assess the liver function. So along with that CBC that you monitor, you will also monitor the chem profile, and you'll pay close attention to the liver enzymes. Are they elevated? Is your CBC, and more importantly your WBC, is it decreased? Because again, if their WBC is decreased, that puts them at a higher rate of infection. So again, know this about methotrexate. Number two, Plaquinol. And if I'm not pronouncing these right, my bad. Now, Plaquinol is an anti-malarial drug. Now, this can cause retinopathy. So your retina is affected. Now, your retina deals with your eyes. So your vision is affected. So you must tell your patient to report any visual disturbances that they notice immediately. Again, with Plaquinol, an anti-malarial drug, you must tell them to report visual disturbances immediately. Okay, because it can cause retinopathy. This may be irreversible damage. So you want to make sure that you inform them of that. 3. Enbrel. Now, Enbrel may increase infection and may also predispose a patient to, or increase the likelihood of the patient suffering from heart failure. So again, with these patients, you need to tell them to report any fever, any bruising, or any bleeding. Number 4, Humira. Number 5, Prednisone. Again, Prednisone is an anti-inflammatory. Now, Prednisone may be given low dose and for a limited time. Now, if you're going to be giving Prednisone, you also have to inform them of the likelihood of weight gain. The moon-shaped face appearance, like in Cushing's. So then, now you're giving Prednisone, well, now you introduce them to another pathophys, in that case, Cushing's disease. So you would give them all the spiel on Cushing's. What are they going to expect? If you don't remember all about Cushing's, then you need to go back and review it, because I guarantee you will see this on the NCLEX exam. And the other thing you can do is NSAIDs for pain control, pain management. And with this, again, you would warn them of the GI problems that may arise from prolonged use. These, of course, are not all the medications, but it gives you a brief synopsis of what you may see on the NCLEX exam.